Okay, here we're going to look at the inflammatory response process. Now, I like the image included here of our foot showing different degrees of inflammation, with this toe having the greatest degree of redness. We're going to learn about a little bit more what's occurring at the cellular level when we see this external appearance on our skin. So starting with in general, the inflammatory response, well, it all starts with an injury, and ultimately it leads to the healing process. We may think of, when we hear the term inflammatory, such as some of the negative factors, the redness, the swelling, the heat, and the pain, but essentially that is part of the healing process, and ultimately this is what has to go through the body in order to try to eliminate sources of infection so that proper healing can occur. Now, the inflammatory response, here's our skin, and we have an injury, a cut, for example, in that skin. We notice it's red and the presence of bacteria here. Our leukocytes, or white blood cells, are leaving the circulatory system to invade this area to try to prevent infection. Now, in general, this inflammatory response is triggered whenever the body tissues are injured. Again, in this case, we're looking at skin tissue. The whole goal, the whole purpose of this is to limit the spread of damaging agents such as the bacteria. Also, the body needs to dispose of debris and pathogens, and this sets the stage by cleaning up this area of potential sources of infection. This sets the stage for a proper healing or repair process. Looking at this image, we notice that three main stages are occurring. First, we have injured tissue, which is up here, and we're noticing our leukocytes are entering that area. Here, this leukocyte in particular, this mast cell, is releasing histamine. Chemicals are causing the blood vessels to expand and become more permeable, and that's causing redness and swelling. So this image doesn't do a great job of showing the redness and the swelling, but what is causing that redness and that swelling is the red blood cells, or the red blood vesicles here, becoming more permeable. So it's causing the redness and the swelling. We have this influx of red blood cells, this influx of white blood cells also to the area. Neutrophils and then monocytes and macrophages migrate to the site of infection or injury. So they're working their way through these, we'll call them epidermal cells, and they're working their way to that initial cut, and here we're noticing some bacteria are being taken in and destroyed, eliminating the chance that they could get into the circulatory system. Now, acute inflammation, we've seen this picture similar before, but it shows the histamine being released, and here we see the white blood cells, or leukocytes, exiting out the vesicle here and entering the area where the pathogens are present. So mast cells detect injury in nearby cells, release histamine, initiating the inflammatory response. Histamine increases the blood flow to the wound site. We see an increased amount of redness and increased vascular permeability, allowing fluid, proteins, phagocytes, and other immune cells to enter infected tissue. These events result in the swelling, the redness of the injury site due to the increase in blood flow. They can also feel warm if we ever have that injury that occurs. Inflammation is also associated with pain due to the events of stimulating nerve pain receptors. That could be because of the initial cut site, or it could be also because of the cascading of events that's occurring. Now, signs of inflammation, there's 5 main ones. We're looking at redness, clearly evident here, the feeling of heat and swelling, evidence of pain, and potential loss of function in the inflammation area. So these are our 5 cardinal signs of acute inflammation occurring. Histamines, which I mentioned before, they help our body get rid of irritants such as allergens. They can make you sneeze, tear up, itch to help remove that irritant. So a lot of times we associate these with being negative associations. Here's all our histamines. Typically, our mast cells are the ones that's inducing those histamines and causes inflammation and or increased mucus production. So if this is in relation to an allergen, this is looked at as very negative, but it can be advantageous in an inflammation sense to help increase the blood flow there and increase the white blood cells. Now, in relation to an allergy, we have things called antihistamines, and they're chemicals or drugs taken in order to reduce symptoms of allergic reactions. They block histamine, as we see here, they're blocking some of those receptors released from the mast cells. They decrease the incidence of symptoms caused by histamine response. So because histamine is not able to bind to all these receptors, the response is dulled. And this is what some of Benadryl, Allegra, Zyrtec, Claritin, some of these antihistamines function in this very similar format, where they're able to block some of the receptors, clog up some of those pores, reducing the effectiveness of the histamine, reducing the allergic response that we have, reducing some of the redness and the swelling and the tearing and all the negative associations that we have with allergies.